Hello everyone, this is Align the Spine Chiropractic. I'm Dr. Ben, and today we're going to go over an ARP neuro treatment protocol for one of our patients, Janelle. We will show her in just a minute here, and we are treating arthritis actually with her in her hands. So far we've seen her for 5 treatments. Average number of treatments for the pathologies that ARP neuro covers is on an average of 20. If you want more information on all the pathologies that ARP neuro treats, please visit our website at alignthespinewa.com and go to our ARP neuro blog. But today we're just going to be covering arthritis. So with Janelle, on our first visit, it was on the 6th of June, and her pain went from 6 out of 10 to 4 out of 10. On the second visit, on the 21st, it went from 6 out of 10 to 3 out of 10. On the third visit, which was on the 28th of June, it went from 3 out of 10 to 2 out of 10. The fourth visit, which was July 12th, we ended up skipping a week because of 4th of July weekend. Her pain went from 2 out of 10 to 0 out of 10. And then today's visit, which is the 19th of July, it went from 2 out of 10 to 0 out of 10. So in only 5 treatments, we got her consistently down between 2 out of 10 to 0 out of 10. I anticipate on the 6th treatment that we will start at either a 2, a 1, or even a 0, right? And that was only in 5 treatments, so about 6 weeks, or 5 to 6 weeks, right? We took a week off in between, and we even took 2 weeks off in between the first and the second treatment here. And so we were treating not only edema and doing some repair and remodeling, but then we went into the actual inflammation process of arthritis. She seemed to respond much better to the inflammation process than she did to the repair, remodeling, and the reduction of edema. So now we're gonna pan over to Janelle here. So we just actually finished her treatment. What we're doing right now is a recovery protocol. So typically we do about a 30-minute treatment, and then we do at the end 10 minutes of recovery. And so right now she's in that recovery phase. She's not feeling a current, and that's called off-duty cycle, but the cells are still being stimulated for the healing process. And we recommend this after treatment protocols or even after performance sessions. So Janelle, can you walk us through those 5 treatments from beginning to end and how, like, what you experienced and how this has changed your life?
So where I really noticed my issue was like in my, and I'm sorry to make a mess here.
Oh, that's all right.
Like my thumb joint and my joint on my first knuckle. And through the treatments, things like, just pulling on socks or pinching a clip together or something has changed dramatically for me. It used to be painful to do those things. And also the one thing that I've also noticed is that first knuckle, when I first started to see Dr. Ben, it was so swollen you couldn't tell the first knuckle from the second knuckle, and now it's back to looking like a normal knuckle versus being all swollen. So from the inflammation standpoint, I feel like it's done a tremendous job.
Right. And then,
Sorry, go ahead.
Oh, and then actually before we even started treatment, she was having some atrophy in her thenar group here. So I was having her do like grip strengthening exercises, but that actually caused her to have a Duchenne's contracture on her right hand. And this treatment actually also treated the
Yes.
Duchenne's contracture. Can you walk through that as well?
Absolutely. When I first started, like in the palm of my hand here was, I don't know, I guess I would say like the size of a pea, and it was really tender and kind of just stood out there. And I showed it to Ben, and he immediately looked at it and said, quit doing the exercise with the, what do you call it, the little
Grip
this thing.
strengthening. Yep.
So I did, and then he had suggested other exercises, and we did the ARP neuro. Anyway, each week it has continued to go down. Now it's just like there's hardly anything there, but maybe just a tiny bump. It's not tender like it was in the beginning, so I feel like this has definitely helped to get rid of that. I was thinking I was going to have to be taken out with a knife.
Right. And obviously we want to try to stay away from invasive surgeries before make sure we treat conservatively before we go invasive. And there obviously are some conditions where you have to go invasive, but we noticed that for her arthritis, you're not taking any drugs to help with the pain.
No.
You pretty much have a pretty good diet, pretty anti-inflammatory diet. You exercise regularly, you garden, and you do things regularly. You're pretty active.
I like to be active.
Right, and because you're so active, when you get older and you have this arthritis that's starting, it starts to inhibit your quality of life, and so then people typically take the pharmaceutical route. Not that there's anything wrong with that, but if there's another way to treat it, and especially if it's cheaper and effective, then that's the route we want to take. And so you've noticed that this has helped your quality of life.
Definitely.
Okay, good.
Things that I couldn't do or were hard to do because of the pain, and like you say, then you stay away from it. Now I feel like I'm doing more stuff and it's not bothering me, so.
Awesome.
Yeah.
All right, so we just let the results speak for themselves. We have the subjective, and then we had the objective we showed you. Through treatment, we're gonna notice that those numbers are gonna keep going down, and eventually, hopefully they'll hold, right? That's what we want, is through longer treatment protocols that we get the results to last, right? And other than that, I think that covers just about everything today. So Align the Spine Chiropractic signing off.